Hello everyone, my name is Ethel Leon. This video presentation is about continuous quality improvement. This project is part of Nursing 711 course requirement under Dr. Reyes. The objectives of this project are define plan, do, study, act, or PDSA cycle, illustrate how PDSA cycle can be used for quality improvement in everyday lives, and ways to improve CQI. Continuous quality improvement, or CQI, is a philosophy that encourages all healthcare team members to continually ask, how are we doing and what can we do better? What are we trying to accomplish? How will we know that a change is an improvement? What changes can we make that will result in improvement? To answer these questions, a CQI initiative uses a plan, do, study, act, or PDSA cycle to test a proposed change or CQI initiative in the actual work setting so changes are rapidly deployed and disseminated. The users of PDSA method follow a prescribed four-stage cyclic learning approach to adopt changes aimed at improvement. The plan stage involves the identification of a change aimed at improvement, while in the do stage, the change is tested. In the study stage, the results are examined for both positive and negative effects, while in the act stage, the change can either be adopted, rejected, or placed through the PDSA cycle again. Problem identified for this project is not being able to exercise for weeks. The Institute of Medicine proposed that goals in the healthcare setting should be STEEP, an acronym meaning safe, timely, efficient, effective, equitable, and patient-centered. The goal of my project is to exercise for 30 minutes a day, 5 times a week, in order to improve heart health, increase energy level, and decrease stress. My team members include Michael, my husband, Matthew, my son, and my friends Carol and Edna. My specific aim for this CQI project was to exercise 30 minutes per day, minimum of 5 days per week. Specific aims should be SMART, an acronym meaning specific, measurable, achievable, realistic, and timely. Measurement is a critical part of testing and implementing changes. Measures tell a team whether the changes they are making lead to an improvement. I measured every day the minutes I engage in exercising and translating this using the metabolic equivalent of task, or MET. A MET is the ratio of the rate of energy expended during an activity to the rate of energy expended at rest. I examined whether each process was performing as projected and whether any process changes were negatively impacting other facets of my life. My change of idea is to be able to exercise 30 minutes per day, minimum of 5 days per week. And my plan is to wake up early on the days my work schedule starts at 8 o'clock in the morning and find other ways during the day to exercise if I am working at 3:30 in the morning. Additionally, I will be tabulating the time spent on other obligations that would prevent me from exercising. I believe that this change to be an advantage over my current process because it has been months that I have not exercised. I postulated that this would have a positive impact on my overall health as evidenced by increased level of energy, reduction in fatigue, shortness of breath, and stress level. Quality improvement offers a variety of tools to help identify source of quality problems and focus improvement efforts. Process maps help teams brainstorm ideas for process improvement, increase communication, and provide process documentation. It also helps identify bottlenecks, repetition, and delays. Another visual tool in CQI is the fishbone diagram. For my project, 6 areas were identified as causes why I lack physical activity. They were people, machines, methods, environment, measurements, and materials. During the planning cycle, I confirmed that having no exercise for weeks decreased my energy level, increased shortness of breath on minimal tasks, an increased stress level which has a negative impact on my overall health. A literature search disclosed that physical activity plays a significant role in combating physiological decline associated with aging. On the week of March 11, 2018, I began my due phase of my first one-week PDSA cycle. During the first one-week PDSA cycle, I missed 2 days of not exercising. Both days, I worked at 3:30 in the morning. I was really exhausted and had very little energy doing any activity. Although on day 7, I noticed that I have less shortness of breath when I do little activity and felt more energized. After studying the results of the first PDSA cycle, I performed a second PDSA cycle. During this cycle, I succeeded again. I only missed day 13 because of work and family obligations. At the end of the second PDSA cycle, I determined there were no negative effects of this change on other facets of my life. I felt less stressed out, noticed an invigorated and decreased cardiac symptoms when doing activities. I adapted this plan because of the long-term positive effects on my health. This figure basically tells you my log on time spent on activities other than exercise. Looking at data calculations from Table 1, I acquired an average of 37.5 minutes per day of exercising. Total number of days was 14. Mean number of minutes exercising for week 1 was 42 minutes, and mean of minutes spent exercising for week 2 was 52.5 minutes. Number of days exercising total was 11 out of 14 days. Now to calculate MET value, it has to be multiplied by weight in kilograms. That should tell you calories burned per hour. So for my MET spent exercising for week 1, I had 913, and for week 2, I had 1,211.5 calories burned. Health benefits of physical activity depend mainly on total weekly energy expenditure due to physical activity. I was able to burn enough calories per week, 913 for the first week PDSA cycle and 1,211.5 for the second week PDSA cycle. Both my PDSA cycles were successful in achieving my aim of exercising 30 minutes per day, a minimum of 5 times per week. I had a total of 3 days that I was not able to engage in any form of exercise. Despite this, I made an extra effort during the week in reaching my goal. Webb suggested that to improve CQI, monthly training programs is essential. Use time studies that offer measurable benchmarks about the time it takes to perform work tasks. Utilize data from surveys to constantly improve. And brainstorming sessions aids the members to work together as a team in order to resolve problems. In conclusion, my CQI was successful, leading to both increased energy level, reduction both of cardiac symptoms and anxiety level. The changes implemented were very simple, effective, and required no expense. I plan on continuing these changes while continue seeking out new opportunities for future improvement. Furthermore, I plan on utilizing CQI knowledge I achieved with this project in my future professional and scholastic undertaking.